Hello, everybody, and thank you for joining me, Natasha Nandini, in conversation with people who know stuff. Today, I'm talking to Dr. Micheal Takacs. He is a dermatology consultant in Lienz General Hospital, but he's been practicing homeopathy since 2001. He has his private practice in Eastern Tyrol, and since 2014, guest lecturer at the Danube University Krems as part of the study of naturopathic medicine. His recent paper, published in the OBM Journal of Integrative and Complementary Medicine, titled Use of Homeopathy in Patients Suffering from Long COVID-19, has some interesting data that I would like to look at first. Micheal, it's really good to see you again. Hello, and thank you for joining me.
Hello, Natasha, and hello, everybody. It's nice to meet you, and yeah.
Thanks, Micheal. Look, I thought we'd start there because I remember in the summer you telling me the story about your patients, your COVID-19 patients during the whole pandemic. And it's fascinating how you managed to successfully identify specific remedies for different symptoms of COVID-19. How did it all transpire?
The whole pandemic started for us in a we were in a very difficult situation, actually. Lienz is in the outback of Austria, let's say. It's close to the Italian border, but our hospital is far away from a university clinic. So if you have patients who are really severely sick, you have to transfer them by helicopter to get them fast and quick to the right management, actually. And we were so close to the Lombardei that we really had the feeling when the pandemic came to us that we are with the back to the wall, actually. So the hospital allowed me also to treat patients together with allopathic medicine, also with homeopathy. And we had quite good success with it. The thing is, in homeopathy, we tried to take all symptoms that COVID-19 can do, like a brain fog, headaches, the pressure, the respiratory distress, pressure on the chest, also the digestive symptoms that COVID can do, the limb pains, diarrheas, nausea, all these symptoms I have put together in the homeopathic repertory. And then I saw which remedies go through all these symptoms and have the best match. So we came to about, let's say, 20 remedies that could work. And then we looked where these remedies have the main action. So that's how it worked, actually, to use the homeopathic remedies for this pandemic.
Oh, that's wonderful. Yes, I remember the exact lineup of different remedies which worked best with certain symptoms. If I don't know if it's possible, but if it is, Micheal, do you think it would be okay to send the link of that that paper at the end of this, at the bottom of this, for people to read if they so wish?
Yes, of course.
That would be great. Thank you. So, and also, if I remember correctly, there was only one who passed away during that whole data. Is that correct?
Yes, that's correct. That was the first wave we faced, and we only lost one patient.
Out of how many patients?
And it was really impressive to see that many patients didn't get any back problems or didn't get any problems after the cure. And also people with respiratory distress got well in a much quicker time than as usual.
It's fantastic, really fantastic.
And at the moment, I have more patients with long COVID, of course, because COVID is not a pending disease anymore, but many people face long COVID problems, the fatigue syndrome, and they come to my practice to get treatment.
And
In long
what is
COVID, in long COVID, it's a big difference in the treatment than in the acute COVID disease, because in long COVID we collect first the symptoms of the acute disease and try first with this remedy that was indicated months ago to get away many problems the patients have. And then we go step by step with the symptoms these patients still face after the first remedy we give.
And how long does long COVID generally last? I mean, obviously it will be different per person.
It's very difficult to say because we don't know enough about chronic fatigue syndromes, and there's much more investigation has to be done actually to make prognosis. You know, we know that chronic fatigue syndrome fades at some point or at some time, but nobody really can tell you how long it will be in your case.
And do you think that the part of the patient, so the role that the patient plays in their getting better, has anything to do with how long the long COVID lasts?
Yes, partially. The quicker we start with the homeopathic cure, the better and the faster they get well. That's what we can say. And the other thing is, of course, the severe long COVID syndromes are really difficult to treat, but the middle severe and the light fatigue syndromes we can cure very easily, actually.
Right. But also the patient has to take some responsibility and perhaps not ignore signs of fatigue.
That's true. The patients have to acknowledge the disease, actually. I have the problem often in my region. Patients, they really do a lot. They go on the mountains. They really are working heavily with their body and also in their leisure time. And they have to get that, they have to recognize, they have to step back. They have to accept that they cannot do that what they wanted in earlier times, that they cannot do it at the moment. And they have really to take care on themselves.
I agree.
Start slowly, step by step.
Yeah, because I'm sure I had long COVID, and during that time, one social meeting of one person a week was already too much for me. And so I really felt that I had to just listen to my body. And some days I was doing literally nothing, but I do feel that I recovered fast because of that, because I was able to not do as much as I wanted.
Yes, that's true. And this is something which is very hard for many people.
Yeah.
But there is also a chance in the disease that you step back, that you think about your life, and that you reorganize many things. I always see in all diseases, you always have a chance to change something positive in your life.
That's a good way of looking at it. Yes, I agree, Michael. Let's look at homeopathy as a practice. It treats the whole person, which means that you see the person not just when they're sick, right?
That's very true. We try to look behind the curtain. That's the big difference to allopathic medicine. We try to explore why this person also gets this disease, or which are the stress mechanisms of this person. And we also want to look what he likes, what makes him feel relaxed, which are these things, and then we count all these things together to get for this person the right remedy.
Right.
And in the last decade, we also think about the inner core of the feelings of patients. You know, it's like if, you know, we now think that all people, they look and face our earth through their glasses. You know, somebody thinks the glass is half empty and the other person thinks the glass is half full. Another person always has the feeling that somebody else is not respecting them. Whatever happens to them on negative things, they always feel hurt and not respected. And another one stands up and goes further, you know, without thinking about that. And so all these things we try to recognize, and we know our remedies even better and better in the last decades, and also match these inner feelings with our remedies. This is the big step in homeopathy in the last decade, I think.
Right, I see. And I mean, so this whole process of getting to know the patient, which is obviously what you have to do to find out this information, is also for the patient an opportunity to get to know themselves because they're answering these questions all the time.
This is true. Many patients say it's very difficult. I have never thought about that, you know, and then they sit here with you and then they start thinking about it and then they answer your questions. And often the good thing is when they just tell you their inner feelings. Often we call that, sometimes they talk nonsense, but it comes out of their inner soul. You know,
Like,
I mean, for example, you have somebody who likes to go into the woods and he likes to different plants. And then when you ask them, they spontaneously talk about an animal or about a plant and what means to them. And of course, it's often completely irrational. And the good thing is that we can take this information and put it in the language of our remedies and find a remedy for this person so that he gets better along with their stress patterns, with their life, the way they perceive life. And when these stress patterns fall off, normally also the disease gets better. It's like the way around. When you have a horse, you can put the things through the head or from the back. And especially in chronic diseases, it often helps a lot that they get the clue, that they don't get stressed anymore, and the level of inflammation, of disease just goes down because of that. Because all of that fits together. You know what I mean? The disease, the body, the soul, our intellectual, our rational thoughts, they all belong together and they all influence each other, I think.
And in a way that they're actually all telling you what the problem is.
That's very true.
And the thing with homeopathy is that the saying is like cures like. Is that right?
That's true. Yes. I think this is a law. It's based on a law. And our founder, Hahnemann, he just looked at naturopathic medicine because this is done by ages. You know, also Indian medicine men, like Aborigines, all these indigenous tribes, they also use this language. And Hahnemann just invented a scientific pattern and scientific provings of his time to get more information about, actually, and to use it based on a maybe, let's say, more certain ground.
Right. And also I know, like I have a friend who's a homeopath and she uses dowsing to help finalize the choice of a remedy. And I remember you were using kinesiology. How did you come by this component of diagnosis?
That's a long story, actually. It has to do with the osteopathic school of the Viennese osteopathic school. I knew some of my friends, they are osteopaths, and they made their education. And then there was some of their teachers, they did kinesiology, and they made a course how kinesiology works, how you can test people. And I said, oh, this is interesting for me also to combine it. And I made this education.
I saw you in action, and it seemed to be quite useful and successful.
I think I also, it's a different method. It's like a test method to get closer to the remedies. And the very good thing is that you also learn homeopathy with this method, because you see why with the kinesiologic testing comes up this remedy now, and then you say I should read it. And then you see, okay, I didn't know the remedy that well, or I haven't seen this aspect of that remedy. And now I know, I get more information about it, you know? So also these methods, they are not, they combined, you learn a lot in both ways.
They shine more light.
Yes.
Yes.
And the good thing is, also through the testing, you get to know that not only one remedy is working at one person. You often find that 3, 4, 5 remedies could work. And then you reread it again in our Materia Medica studies, which remedy you give. But it's also a good feeling to know also if you give another remedy, it also will do something good at the person. Maybe not that good as the one you chose at the end, but they also would help for the cure.
Maybe on another level even.
Yes, exactly. Yeah.
Right. So just talking about different levels, because when I look at homeopathic remedies and I see 1M, 10M, 30C, and I mean, it looks like Roman numerals, but I don't actually understand what that's about. Could you shed some light on that for me?
The different potencies in homeopathy, they act in a different way, actually. So a potency which is very high will act very long, and it will act much more at the subconscious and conscious than on the body itself. So we have, it depends which goal you want to reach, actually. You want to, if you have a quite healthy person which has one problem, you can give him a high potency, and it will help this person in his personality as well. But if you have, for example, an old person, a weak body, many problems, you maybe take a lower potency and give the remedy more often and repetitive, just like a drainage, you know, like a drainage of the body or for an organ. Like you say, this person has a problem with the liver cycle, for example, you can give a drainage remedy, which you give every day in a low potency and which will do something good for the liver or for the spleen or for this system. And you can also combine it with a different remedy in a high potency for the person itself. So you have many ways of treatment. And this is, I think, something I'm also learning in the way and in the age I grow and I do this medicine, that you have many accesses and they are many individual to each person, and that makes it very rich and very interesting.
Just to clarify for people, a low potency, would that be 30C?
That would be C12, for example, C6, for example. C30 is a middle potency, which is in between. I use it very often in acutes, or I use it once weekly if I want to use it as a drainage remedy, or as an acute remedy, I use it twice a day. But with the high potencies, of course, you give them, for example, only monthly, a C200 or a C1000 every third month.
Right, I see.
It depends. And this is also fascinating. Every person reacts in his individual rhythm and in his individual pace on the remedy. So you have to watch them when you repeat the remedy again and how long the remedy is acting.
Well, talking about that, like when I used to take homeopathy, I don't now because it's so potent, or at least I have such strong, it affects me so strongly. I remember taking a remedy, within 10 minutes, I was so bossy. I was so bossy that I actually stopped and realized I was being bossy, and I had to tell my friend, look, I'm so sorry. And she was like, well, thank you for apologizing. That's how strong it was. 10
Yes.
minutes after taking it.
Especially sensitive persons. Susan, my wife, it's exactly the same. I often give her only 5 remedies in water, diluted in water, and she makes one sip, and 10 minutes later, the remedy is working. You know, she can say, my liver complaints are better. Then now they start getting better, you know. And this is really fascinating. Another person needs repetitive dosage and intakes, and then suddenly they realize, now it's better, or it's better after 3 weeks.
Mm. And so another question on the potency, or rather, if you're giving a remedy once a month, say, like the high dose, does it, like for some people it might be instantaneous, but you take the remedy and then over the period of a month, can it go through different stages of things?
That's true. That's how it works. Yeah.
Right.
For example, you had in your past different complaints, like you had maybe a sprained ankle, you had 10 years ago stomach trouble, stuff like that. What the remedy does, you give the body an information, yeah, and the body takes the information and goes into resonance and is working with it. So the body and you are working through with this information, and it can be that your sprained ankle after a week suddenly starts to hurt for 2 days,
Yeah.
or that your stomach troubles come up a little bit. It's not that you get the stomach troubles again, but the remedy makes something like your body makes a regulative process, goes through a regulative process, and that helps to make the whole system healthier. Like you do it with your yoga, for example,
Yes, yes.
or like somebody does it with acupuncture.
Mm.
You give the body an information. The one does it with acupuncture, another one with a homeopathic remedy. Also, your immune system is working with this information, and that makes people healthy.
It just reminds me of a saying that my homeopath used to say. She would always say, better out than in, better out than in. And is that
Yes,
a homeopathic term?
yes. This is very true. We see, for example, cures that go from the inner organs to the outer levels. Yeah.
Mm.
Hering, a homeopath, an American homeopath of the last century, he made this law. He was explaining his pupils how the action works. And you can really often see that. I had, for example, patients, they came with eczema on the hands, and they have a strong asthma on the lung, yeah, an allergic asthma. And I gave them the remedy, and they came back and said, it's awful. My hands are not better at all. And I said, then the remedy did not work. And they said, no, 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 it worked brilliant. I can breathe, you know? And we made the cure over 5, 6 months. And the last thing that was best were the hand eczema, but the lung got steadily better and better, and even the lung functions, they went up to normal. And this is how cure works.
And would you say that the eczema was connected to the lung issue as some kind of offshoot?
It was probably connected in the way that both was allergic. You know, the eczema was a kind of allergic reaction, and the asthma, of course, as well. And so that's what we always say, cure goes from the inner parts to the outer parts. And this is something you have to learn as a homeopath, to take the information and to put it in the right, to put it together in the right way. Otherwise, you make errors in your cure.
Well,
Because maybe you switch the remedy too early, because you think it doesn't work, but in reality, it is working really well, and you just have to be calm.
It's like deep, deep, deep work.
Yeah.
So I have a few homeopathic terms that I would like you to shed light on for me.
Yes.
So the first one is miasm, which I hear a lot connected. Yes.
Miasm is just the level on which a disease is working. So if we talk about miasm, it's an old term from the last century, actually, and it's a very theoretical. These are very theoretical terms, and not so easy to explain. Actually, it's not only your, not only your problem, also our problem to understand it. But the thing is, we have remedies. They have the same symptoms when you look through the materia medica, but they start from a different origin. So it is like you have, for example, people, what they get is always an overproduction in the body. Like the body is too hot. If they get a cough, they get a lot of expectoration. They get a lot of sticky fluids, for example, and they are we call that hyper. We would say they have an hyperaction, and this is psychotic, for example. But we know remedies, they are psychotic, they are psoric, they are syphilitic, they are more destructive, and still they have the same symptoms. When I use my repertory and I go through, all these remedies come up. And then I have to classify, where stands this human being? Is that more a normal level they have, and they have maybe a little bit more insecurities and fears? Or are these persons, they are more driven and they are more hiding up and they are pent up with their problems? Then they are more psychotic. And for example, persons who have in their family story many destructive processes, then we will use for them a syphilitic remedy, which is more destructive in its action, but it takes more part to the background of the patient and his history and the family history and stuff like that.
As you say, like cures like.
Yes.
Right.
And we have to recognize these things and differentiate also on these levels.
Well, it's like a lifetime learning, isn't it?
Yes, it's a way of learning, like yoga.
Yes. Yeah.
You never stop learning. You never stop learning.
Yeah. And one helps the other in a way. They're all kind of, shining light in a different angle.
Yeah, that's true.
So I have another.
With the miasms nowadays, we also see that people are behaving, how people behave with their stress or how they feel inside, that this also belongs to miasms. It's different if somebody never talks about his problems. That's typical psychotic. Other people get a lot of fears. That's psoric, for example. Other people always feel like being excluded, you know, and the people who were most excluded were people who had lepra, for example, leprosy, for example. So we now know these things also on a psychologic pattern and can be even more precise in prescribing our remedies.
It's lovely. That's
Yes.
great. And so I have another term. It's the law of infinitesimals.
I don't use this
It's
thing.
like,
I think you mean the kind of potency. No, you potency, and you get less and less molecules in your dilution.
yes, that's what I
Yeah.
found that quite interesting, that it's stronger with
Yes,
when it's reduced.
this is a paradox, actually. We don't have an explanation now for it, but it works like that. And there are, of course, we know it's not working on a chemical base. We know we give the body an information, you know, and even if there is less of the molecule in the dilution, it still acts clearer, is more precise, and there are actually some studies made by physicians after the Second World War who could show, for example, that water has a memory. And this explains that the water can take this memory and can take information and can keep information. Yeah.
On that subject, is it like you mentioned resonance? So is it like a vibration that the remedy is holding within it? Because vibration is the most subtle that I know of in the third dimension.
Yes. We don't know yet. We
Ah,
cannot
okay.
really tell what it is. Is it a physical phenomenon? You know, is it on which what really happens immediately? We don't really know. We know that the tissues react. We know that the immune system reacts. We can see that and in our clinical practice, but how it really works in the end, we don't know yet. Like we also don't know with many allopathic school medical medicines. It's not everything explainable, actually, and
No,
it's still working. Yeah.
it's work in progress. Yeah. Yeah. So I know that when the remedy is being made, it's like this reduction process. It's like
Yeah.
there's like a dilution and then a shake and then a
Yes,
dilution and a shake. Is that right?
that's right. Yeah.
So then is it, I mean, what I think of or what it reminds me of is like when you're making a stew and you reduce and you reduce and you reduce and it gets more and more concentrated.
Mhm.
Is it similar to this?
Yeah. But it's not the concentration.
Right.
It's the way around, and still,
Okay.
but the what we have, the pattern, the pattern of information which is there gets stronger and stronger, and even narrower and narrower. So when you use high potencies, you have to be very precise. Also to the patient's how the patient is actually.
And I'm interested in the view, you mentioned eczema and allergies. I'm interested
Yeah.
in the homeopathic view of allergies in comparison to allopathic, because like allopathic medicine really doesn't, in my opinion, cure anything. It just shoves stuff under the carpet. That's what I see. Well, that's my
It
understanding.
depends what they do. When they do a hyposensitivization, we called it when you use these injections to reduce the stress of the allergy. This is actually something where the allopathy plays a trick on the immune system. it lowers the reaction of the immune system and shifts it to another focus, actually, which is more subtle than just giving an allergic tablet, which pushes everything down. You know, so we have to differentiate these two mechanisms. In homeopathy, it is you can do a cure that you also lower the immune system. So in this way, it seems to correspond a little bit with the allopathic medicine, but in a different way, of course.
Right. And how would you start to treat someone who was, say, wanting to switch from allopathic treatment to homeopathic treatment? I mean, how would you?
Yeah, what I do, in my opinion, I take his record. Like I try to find his constitutional remedy. This is the most important thing, because then you lower the whole all the pathologic patterns in the body and in the mind. And of course, I would try to find for him the acute remedy for his allergy. And normally that works very well together. So that in the acute state, he gets the acute remedy, and during the year, he gets his constitutional remedy. And that means when I record it, I start with how were the patients, how was the father, how was the mother, you know, which diseases they have. Normally then they talk about their youth. It automatically comes that when you say, how is your father? You say, yeah, my father was this, like that. And when I was a young boy, this and this happened. You know, this is like a continuous flow of telling you things about his youth. And then you know, how was the family? How were the brothers? How was the sister? What came up, and how was this person as a boy or as a woman, as a girl, you know? And then later, which life events came, you know, which diseases came. And so step by step, you get the whole picture of a person, and then you try to find the right remedy for him.
Because it's the picture of the person through their eyes, or how they understood the family unit.
Yes,
Because
of course.
that also
And
changes.
and often you have like a red line going through the whole life, and then you have to prescribe for this red line. In homeopathy, in the old terms, they said it's a delusion. You know, it's a
Right, delusion.
delusion. And we can look in our rubrics, and there we will find delusion. Somebody, delusion being left alone, for example, or you know, or delusion traumatized, or whatever comes up. But it's always my inner feeling. It's always my inner perception of the world outside. And this, to understand, is the big clue, actually.
Right. And just for people who may not know too much about homeopathy, would you say that I think you have to tell them that you need patience? It's not like you take a remedy and you get the result necessarily immediately, that it's a process.
Yes, we have to tell them, actually.
But a successful process.
But the interesting thing is that when you are in such an interview, you come out, and many people understand that if a doctor asks you all these questions to get to something, that they are now on a travel. You know, because they had to reflect through their whole life and lifestyle, and then of course they understand, okay, there's something else happening afterwards, also with the remedies.
For sure, yes. Well, we're well into autumn in the Northern Hemisphere now, and You stated that this is a good time to get one's veins checked. Why is that? To get
No, not,
winter and autumn is a good time to have the veins checked.
no.
One's veins.
I know you get me wrong. You got me wrong.
That's what I saw on
It
your
is, no,
website.
no. Yes, it has to do. Okay, I understand now your question. It
Yes.
has to do when you are. I'm also working as a phlebotomist,
Mm.
so I do a lot of procedures on the veins, and these procedures you only can do in wintertime
Yeah. Why is that?
because in summer it's too hot. The veins delayed, the veins get bigger.
Ah,
The outcomes, if you do sclerotherapy or you do an operation on the veins, are not so good. You have more skin. How do you call it? You have more hematoma, for example. The healings, they
you, you
they
mean bruising?
yeah, the bruisings, they are longer in summer, you know. So
Yeah.
it's the best time to do all those procedures, of course, in autumn, winter, springtime.
I see. Great. Well, thank you for that. I mean, this has been extremely informative, and I really want to thank you for spending your time on a Saturday with me to explain.
You're welcome. There's maybe one thing I want to state with homeopathy. You
Yes.
can you can use homeopathy on many different levels. You can use it like I stated it with the mental side also, but you also can use it just as an acute remedy, you know,
Mm.
just on basis on acute symptoms to throat pain or something, and the remedies will pop up. And of course, you can cure, for example, throat pains without knowing the whole patient, or
Mm.
you can use a remedy we know very well for hematomas and sprains. That's arnica, for example, and you can use it as a drainage remedy for 1-2 weeks, and you will see that the swellings get much better in a quicker time. So homeopathy you can use on many, many different levels. And it also, if it's very complicated on a level you want really to cure the whole person, you still can use it also for acutes.
Well, you just reminded me, actually, we have a homeopathic shop here in London, and
Yes,
it's called Ainsworth, but there they have an emergency kit. So
yes,
that must be something
yes, something like that. And
yeah.
these things, they work. That's the funny thing. And so you can use homeopathy on many, many different levels, and it's probably the most individual approach
That's wonderful.
with the most individual reactions. So also, if a homeopath is a beginner, he can do many, many good things for many, many people without knowing all the concepts in the background, And the longer he's working his way up, then he understands the whole thing in a very, very different way, or sees the things in a different way. And still, you can do cures. And I
Yeah.
think this is also a big, big thing in homeopathy, that it's so individual, and you have so many approaches you can use, and still it's the same discipline.
It's kind of expansive in a way.
Yes,
That's
yes.
lovely. Well, thank you again, Micheal, for all your wisdom that you're sharing with us. And please, give my love to Susie. I hope to see her soon as well. Um, Thank you, Micheal from Austria. There are many ways to heal ourselves, and finding the one that suits us might take time. Whatever path we choose, the true journey to health is the one that comes with no hidden side effects. I hope you found this conversation as enlightening as I have done. Take care for now, and see you soon.